Masaka Referral Hospital drug store has run out of anti-malarial drugs. Caretakers and relatives of patients suffering from malaria are finding it hard to cope. This has forced many of them to purchase the drugs from private clinics, which is costly.
Our lives are in danger. There are several lines in the hospital looking for anti-malarial drugs. But the nurses and doctors, and you cannot blame them, because if the medicine is not there, and it is the only panacea that can cure a disease, that we request the president, even the kingdom of Uganda can come and help us.
Masaka Hospital senior drug dispenser Beatrice Kasisi says they only received 8 boxes of anti-malarial drugs for adults from the national medical stores, which they are forced to share with children because of the shortage.
Like now, I was supposed to be having enough for at least 2 weeks, but presently I only have enough for 1 week, so which means even by the time they supply, I'll not be having any quantum. We had to shift. We supplied all the ages according to what we had, because we could not leave the children to go without, and yet this quantum could serve both for children and for the young ones.
Eliazer Mugisha, the principal administrator, attributes the shortage to big numbers of patients who seek treatment at the hospital. He says the hospital requires drugs worth 1 billion shillings if they are to meet the target of their patients. Meanwhile, today, the Ministry of Health launched the Affordable Medicines Facility for Malaria to combat the increasing rate of infection and morbidity from the disease. Programs Manager of the National Malaria Control Program, Jimmy Opigo, told NTV on the sidelines of the launch of the campaign that the rationale is to make the anti-malarial drugs available to the vulnerable groups of people. He says the program will address the question of drug resistance to malaria.
To make people move away from chloroquine, which we have taken off the market, and you replace it with something which is 20 times the price, you need to do something about the price if you need people to consume the thing and consume it properly.